Good morning, everyone. Hello, Facebook. Welcome to another edition of SCAN FYI. I'm Andrea Tarr. I'm the program director at SCAN.
Good morning, everyone. I'm Marybeth Kwapniewski. I'm the program coordinator at SCAN, and we're happy to have back with us Dr. Fisher from Monmouth Medical Center. So good morning, Dr. Fisher.
Good morning.
Pleasure to be here with you.
We're so glad to have you back. We can't believe that we last spoke in June. A lot of time has gone by.
Yeah, wow. So what's happening that what's
That's
new?
a big question.
Yeah.
What's new since we saw you last?
So things were a lot happier in June. Our numbers were down. Things were staying pretty quiet. New Jersey was not seeing a lot of disease. We were beginning to open things up. You know, everything was looking reasonably well. The rest of the country, however, was having problems with increased incidence of disease over the summer. And then the fall started and we thought, well, maybe it's going to go down again. And unfortunately, we just went exactly the wrong way. So the numbers of new cases are increasing every day. We've been more than 100,000 new cases in 24 hours for the last several days. And the number of deaths, unfortunately, is increasing. And we know that while it looked like it might be leveling off a bit, we're very concerned that we're going to be seeing many more cases after the Thanksgiving holidays because of the increase in travel and the increase in groups gathering and therefore increased disease. And we know that generally the disease lags about 5 days after exposure, and then it takes about another week for you to be sick enough to possibly need hospitalization. So this is just about the time where we expect to see a peak on a peak related to Thanksgiving. And then, of course, we're coming into Hanukkah and Christmas and
New Year's,
and all of the holidays that go around this time of year. So again, we're concerned that that the disease may continue to increase, unfortunately.
it's not good news.
Not good news at all. And it's unfortunate because we now have even more information that the simple things do decrease transmission. So keeping physically distanced, that's 6 feet away, wearing face coverings, wearing a mask really makes a difference. More and more information is coming out to show that wearing masks clearly decreases transmission of this virus. It protects the person wearing the mask and it protects others from the person wearing the mask. So we just have to continue to be vigilant. I know that we're all tired of this disease. Yeah. We're all, fatigued beyond belief. But we now more than ever, we need to be following the rules. As you're going out for holiday shopping, think twice. Maybe you can order it online. Right. Maybe you can do it some other way. Maybe we wait this year and just take a break. It certainly is not the time to be sending children to go see Santa. Write the letter to Santa, Zoom with Santa, but don't go physically and stand in a line and increase the risk, not only to your children, but of course to you, because you're out in the world. So I don't know what increased restrictions will be placed on us here in New Jersey, but we are definitely seeing a dramatic increase in hospitalizations. We still have lots and lots of outbreaks among the long-term care facilities. So it's overall, it's just not the kind of good news that I would like to be giving you. But in a minute, I bet we're going to start talking about the vaccine, because I think, there may be some light at the end of the tunnel. It's not going to get here fast enough for many of us, but at least we have several vaccines now that are getting very close to being available. They will be available under an emergency use authorization. So we'll be able to get the vaccine out and get people protected.
Dr. Fisher, how will it be decided who will be vaccinated first? What is the priority here?
So the Advisory Committee on Immunization Practices, which is a group from the Centers for Disease Control, it has a number of of representatives from all the groups that you could think of, all the people that should be there, including a public representative. They are currently, and actually by the time this is aired, they will have decided for sure who should get it first and how the vaccine should be rolled out. So the plan currently is that the first people to get the vaccine will be healthcare providers.
That
So
seems
anybody who works in a hospital or in an outpatient setting, or those people who go out, the Visiting Nurses Association, people who do home care. And it's not just the doctors and nurses. This is everyone who works in this industry. So the people who keep the dietary thing working, the people who keep our hospitals clean, the people who do the maintenance, everyone who works in a healthcare setting. They will be the first group, 1A. The next group will be the essential workers. So the people who are responding, our first responders, the people who are making life go on despite all of the challenges and the horrors that we're facing. So people in the food industry and transportation industry, those essential workers, the teachers, those will all be included in that next 1B. And then 1C will be people with high risk conditions. So people who are more likely to get sick or sicker from this infection. So those who end up being hospitalized, ending up in intensive care, and unfortunately many of whom have died. So that will be the transition. We'll start with healthcare workers, move it to essential workers, move it to high risk people. And then hopefully by spring, we may have enough vaccine to go to the general population.
spring. That feels a long way off, but
Well, but it's only 6 months since we last talked. So
Same
spring will
time
be
frame.
here. Spring will be here before we know it.
all right. The priority that you're describing, Dr. Fisher, is that for New Jersey, or is that a general thing?
That's a general thing. That's for the entire country, and
Okay.
I have no doubt that New Jersey will listen to the recommendations of the advisory committee.
So to our listeners out there, you might notice that Dr. Fisher seems to have an awful lot of information about this stuff, and there's a good reason for that. Mary Beth, you want to share the news?
So we do have a congratulatory
Yes.
coffee mug toast for Dr. Fisher. I want to make sure I get the title correct. So Dr. Fisher will be joining New Jersey as the director of the Office of Pandemic Response and helping to roll out the state's distribution of the vaccine for COVID-19.
Congratulations, Dr. Fisher.
For sure. Very
Awesome.
nice.
It's an exciting time and a tremendous challenge. And fortunately, I'll be joining a department that has just done an incredibly good job of getting us ready and getting the state ready for this. And we really want people to understand that we have lots of preparation. We're going to be sure this vaccine is safe and effective. And, and as soon as we know that, we're going to get it to as many people as we can so that we can really stop this pandemic and get people, back to their lives.
No, I think it's true that, we're tired of the pandemic, but we're just tired in general of, and I guess for a lot of people, they've let their guard down.
Yes.
So
And now it's not the time.
No. And honestly, everything that you told us in June about things to do is everything that you're repeating today. So I guess, if anything, we know that to be even more true than we did in June.
Right. And even after we
wear the
start with
damn
the
mask,
vaccine,
people.
even after you've been vaccinated, we're still going to say, wear the mask, keep the 6 feet distance, and wash your hands, and and if you're sick, stay at home. The good news is all of the things that prevent transmission of COVID-19 also prevent the transmission of influenza. So we're hoping that because people are paying attention, although clearly not as well as I'd like them to, but at least many people are paying attention, that we hope that we're going to see a much less severe influenza year. And in fact, we've had very, very little influenza so far. And, we're now approaching or beginning December. So, it's nice to see that.
The symptoms for flu and COVID are very similar.
They are almost identical. The one symptom that has not been reported in influenza is the loss of smell and taste.
Ah, okay.
So that does appear to be a little more specific for COVID-19, but all the other symptoms, cough, shortness of breath, sore throat, aches, body aches, headache, all of those, chills, fever, diarrhea, GI upset, all of those are exactly the same for influenza as they are for COVID-19. And the risk groups, the people who are more likely to get sick, are also exactly the same. So older individuals, individuals who are overweight, individuals who have other health problems like high blood pressure, like lung disease, asthma, chronic kidney disease, all of those things that put you at risk for COVID-19 also put you at risk for influenza.
So would it be fair to say that to err on the side of caution, if you think if you have symptoms, maybe even, I hate to use the word assume, but assume that you may have COVID and go out and get a test?
Absolutely.
Yeah.
And be
All right.
careful as you're going out to get the test. Remember, we don't want you
True.
to expose a bunch of people as you're going
Right.
to get that test. So the drive-through tests, the tests that don't involve you being in direct contact, except with the person who takes your specimen, are really the way to go.
I'm seeing more and more places that are offering the drive-through, so that's a good option for people. So you don't expose people. You're right.
Exactly right.
You're right.
Dr. Fisher, have you seen some of the communities doing random testing that maybe don't belong to an assisted living community? I know the colleges were doing that all throughout the semester.
Yeah, and I've noticed there are a few schools that have put that into place. They've said, okay, we're going to go back to school, but we're going to do random testing of either one particular classroom. We'll switch between classrooms. I'm not sure there's particularly any medical validity to this, but I think that it does make people feel a little more comfortable to know that they're being watched, they're being looked after, and we really are trying very hard not to be spreading the disease in places like schools.
Well, and you're catching those asymptomatic students that aren't presenting, right? So you know if there's
Right.
somebody in the classroom.
Right. Exactly. What do you want to say to everyone out there who's now preparing for the holiday season? Because obviously we've not done a great job recently, but what do you want to say to what do you want to say to them?
So what I want to say to them is, you know, you've heard this way too much, but this isn't like any other year. So we really want you to think about your loved ones first. And the best thing you can do is not expose them to SARS-CoV-2. So keep gathering small. Anything you can do outdoors, try to do it outdoors. If you don't feel well, get tested, stay home, don't expose other people, and please wear the mask and keep your 6 feet physical distance.
When you say it, it sounds so easy,
Yeah,
right?
it's not always so easy though, you know,
I know,
especially when
I
you have
know.
little ones at home.
I know. So are we still kind of avoiding our little grandkids, kind of no hugging and kissing with the little kids?
Unfortunately, yes, we still do have to worry, but
Okay.
we have seen that, yes, there are children in school who get this, but there does not appear to be a lot of child-to-child transmission, and not a lot of that we've seen. We haven't seen child-to-teacher transmission.
Oh, that's good.
So perhaps you'd be okay and they wouldn't transmit it to you, but we know they can transmit it to you. So again, you have to think, what are your personal risks? And they're not going to be the same. You know, each one of us here has
Right.
different risks depending on
Right.
our age, depending on our weight, depending on what comorbidities we have. So all of those things matter. If we're at very low risk, you know, maybe, you know, you don't need to be quite as careful. Although remember, low risk people come into contact with high risk people. So, you know, the deal is protect yourself and protect your high risk loved ones.
The thing, you know, it's a gifting season for a lot of people, and we don't want the gift we give to be the virus.
Correct,
So
correct,
that's an important thing to remember.
right.
Oh, Dr. Fisher, it's been really wonderful to have you with us. And, once again, let's just congratulate you on your new
Yes.
position.
Thank you.
It's the best.
Thank you. I'll drink to
Thank
that.
you.
New Jersey's lucky to have
Thank
you.
you. And have a wonderful day, everyone, and stay safe.
Thank
Okay.
you.
All right. Well, thank you so much for being our guest today, Dr. Fisher. And remember, if it's important to you, it's important to us. I'm Andrea Tarr. See you next time on Scan FYI.
Have a good day, everyone.
Bye, everyone.